Hello, good afternoon. Morai Curran here, and we have our last webinar of the day. It is Wednesday, and so the topic we have today is how can I create a salon spa menu and reach out to people living with cancer. So let's look at this overview of salon and spa menus, because traditionally salons and spas have one spa menu, and this lists a number of different services that you provide, and within each category, for example, with facials, there could be a number of different facials, or waxing could be broken down into a number of different body parts, etc. So that is traditionally, we've always had a one sort of standard spa menu. So now we're trying to entice cancer survivors into our, salon or spa. And the dilemma sits with us as to, do we have a separate salon spa menu for them, or do we continue to just use the existing salon spa menu? There's lots of ways to look at this. From an economic perspective, if you're printing, having one works better. And you can also put it onto your website like that, but it's easier to change the digital. So you might have one printed one that is your regular spa menu, but then you might also just have something written up on your actual website that specifies that you modify services for people that are diagnosed with cancer. On the other hand, having two separate spa menus, your traditional one and one's very specific for people with cancer, can be seen in two different ways from cancer survivors. Some cancer survivors want to be treated like they are normal, they just are not feeling well, they've just been treated for it, therefore they want to stick with your traditional one spa menu because they don't want you to be sort of isolated out as something different. So those type of people are not interested in a separate spa menu. Yet you get the cancer survivor who totally embraces the fact that you've gone to all the trouble to create a very specific spa menu for them with treatments that they can select from there that are modified for them. So, it is a bit of a conundrum for some people, because we want to sit there and say, I really like the idea of a separate spa menu. And perhaps one way you can get around that is, look, I have a traditional spa menu. You can pick and choose from that, but we have specific, like we have a specific facial that is modified for you. And so we put it onto a separate spa menu and, just have it available. And if just having it in a digital form is the best way to do it, that's fine too. But you're also trying to appeal to cancer survivors, and just remember, they all respond differently to this. So when we're looking at putting together a spa menu as well, so where are we actually using the spa menu? So we might be trying to consider actually working together with healthcare professionals in a cancer center, or we renting a room in a hospital where we would like to offer services to anyone in the hospital, or do we want to target specifically cancer survivors? Again, it comes back to how many services can you have? And I mean, you can also have a very simple traditional spa menu where you just have a few services that can encompass both. If you're a cancer concept spa, or you're planning to become like that, then have something very specific And maybe it doesn't have to be every single treatment that you write something there. Maybe the overall concept of your spa menu is, we are a cancer concept spa. Therefore, any treatment that you have that's listed on our menu is modified for you according to your side effects on the day that you have a treatment. So it can be very specific that way. In regular day spas, when I say day spa, you could be a mobile service, you could have your own spa where you're an independent, or you could be working for someone. So in that setting, a lot of us have just a regular spa menu to work off with, but then a lot of people in regular day spas are not modifying for people with cancer. So you also have to look at, you know, where you're actually going to use that spa menu and how you want to market it, because having something separate can be a plus or a minus for you. So again, putting your spa menu together, I'm leaving the word salon out because it gets a bit of a mouthful, but you know, we're actually talking to hairstylists or cosmetologists, we're talking to nail techs, we're talking to everything. So for ease of the webinar, we'll just stick with spa. And what can you, as a spa professional, provide to somebody that's going through cancer? We're trained to do basic aesthetic services, and that could be the different facials, it could be hair removal services, it could be makeup. There are machines and equipment that we get trained on, but let's stick with basic here at this point in time, because we'll talk about equipment later. And what advanced services or treatments can you offer? Have you done any advanced training? Perhaps you have trained in radio frequency, maybe you've trained in dermal needling. So what additional things can you do that could benefit that person, especially when they're going through active cancer treatment, but then also in recovery? So make up your list and then make a comparison with some of the things that I'm going to talk about right now. Because these services are currently being utilized in healthcare settings for people with cancer. So they're recognized. A lot of them have got clinical studies to support them, and that is why medical professionals will be more open to them. For example, massage therapy has like 300 clinical studies out there showing the benefits for pain, nausea, vomiting, insomnia, and other symptoms. Massage therapy is also used purely for de-stressing and relaxation. Cranial prostheses are wigs or wig pieces. The reason I put that in there is because that is how it is termed and recognized by insurances for reimbursement. Sometimes reimbursement can be done for massage therapy, cranial prostheses, breast forms, areola tattooing, skin taping, and then also on the next slide, there is complete decongestion therapy, which I will talk about in a bit there. So breast forms is another thing. You can be trained as a fitter, and that means you're actually measuring a person and fitting them and matching them with a breast form that suits their other breast. You're helping them with bra selection that works with swimsuits and nightwear and exercise gear and stuff like that. But this is for a woman's femininity and sexuality. A woman wants to feel and look good, so breast forms is really important if they haven't had reconstructive surgery. For those that have had reconstructive surgery, areola tattooing, really important, and it's really important that somebody that does areola tattooing on either fibrotic breast tissue or over scar tissue resulting from the actual reconstructive surgery, they need to know how to work with that type of tissue, because things can go wrong with that and people can get infections. So you also want to have somebody doing areola tattooing that is extremely creative and artistic so that it looks extremely natural. Skin taping is done a lot of the time for taping, for scarring, for lymphedema. It is often used in rehabilitation with physiotherapists or physical therapists. We will also be offering skin taping, again, for use over scars, for bruising, for temporary swelling. We've got to be real careful about and crossing over the boundaries to working with pain and that, but that's still another option that we can do. It works with, toning and cellulite, and it can also help with aging skin as well, like on the décolleté. So complete decongestion therapy is mostly for lymphedema, and lymphedema is a swelling in a quadrant of the body that is affected because the lymphatic system is impaired and lymph nodes have been either removed and or radiated, and the fluid, the protein, is now accumulating in areas, and of course there's also gravity that is a problem. And so if somebody's had lymph nodes removed in the underarm areas, typically the arms are affected. Sometimes the actual body itself in that quadrant can be affected, but then with gravity, all the protein in the tissues is actually sort of draining downwards to the fingers. And so the first signs of this is that the fingers start to swell, and then the wrist. And so complete decongestion therapy is manual lymphatic drainage, and it has to be supported with compression bandaging. As the lymphedema continues to develop and is under control, there is skincare that has to be adhered to, because skin can change once lymphedema is present. And then there's also exercises that need to be done. When we talk about aromatherapy is used a lot of the time for psychological components. For example, people that reach a point when they're sick for not eating, they just don't feel well enough, and their bodies are not desiring food anymore, and something called petechia. And if you start to use something like a mandarin or a blood orange essential oil in a diffuser, that can help stimulate a person's appetite. So that's the psychological component to it. Aromatherapy is very powerful with its antibacterial, antiviral, antimicrobial benefits, and is now being used in a lot of hospitals for wound healing. It's helping work around the skin and being used topically on the skin as well. Sound therapy, for those of you that are not familiar with this, is a no-touch treatment or therapy. It's the use of musical equipment. It would be like drums and triangles and flutes and Turkish bowls, crystal bowls. Again, vibrational therapy. And if you haven't tried it, seriously, very relaxing. Reflexology is done mostly for symptom relief and also for relaxation. I find, though, because I have a lot of experience with reflexology, that sometimes if a person is, for example, not feeling well, when you do reflexology, it really upsets that energy in the body, because the person's body is trying to fight whatever it is, and then reflexology just brings it on full force. So sometimes reflexology can actually give the opposite effect immediately, but a person may feel worse and then they really do get better after that. So you've got to understand that that's done. And reflexology is not a foot massage. It is a 50-minute treatment that is very specific to working. And the way I'm trained, it's not just working with the organs in the body, it's also working with the meridians and the 5 elements. So meridians are those energy lines in the body that acupuncture is based on. So not a foo-foo treatment at all. You've got to know what you're doing. Reiki, very, very much in demand at the moment in a lot of cancer centers. And again, another therapy that is working on energy healing and relaxation. And it's a no-touch therapy too. So there are going to be times that you can't actually touch somebody because they may be in extreme pain, because of their bruising and bleeding, because of their low platelet count. You can actually safely do no-touch therapies. Yoga or healthy steps, which is a form of exercise, and exercise for people that have recently had surgery. It's to get their system moving, but they can be sitting down whilst they're doing these exercise movements. So extremely good for everybody to be encouraged to do some form of exercise. We did talk about wig fitting earlier as a cranial prosthesis, but you know, oftentimes it's really for the cosmetologist, but it doesn't have to be. An esthetician can also go out and learn about wig fitting. And when I say wig fitting, let's say the esthetician's really good at sewing. A person that has an ill-fitting wig, it's too big or too small for them, a person that can sew can actually add an additional piece of fabric to the wig, or they can take it in. They can also attach synthetic hair to any parts that might be destroyed from heat, like opening up an oven door and stuff like that. So there is a huge place for people to help, you know, survivors get wigs that fit properly and look natural. Foot and hand treatments and nail services are definitely recommended for people as well. There is actually a massage technique now for peripheral neuropathy, but the cancer survivor has to do a lot of work at home, or the caregiver has to help with that. And nail services, mostly for people that are going to chemo, their nails can get affected, whether it's discoloration, whether they become brittle or they just peel off. But also just bear in mind, nail services do bring about bacterial and fungal infections, and also can get quite severely infected. So we've just got to be aware of a lot of these side effects with these treatments. So these are a lot of services that cancer survivors are getting in hospital settings, and we want to continue to actually include what we do as estheticians mostly. And a lot of that would be skincare. And I put us into the category of appearance recovery. And if you've listened to the webinars we've had in the last 2 days, I talk about what a cancer survivor's intent is when they come to the salon or the spa. What is the purpose for them coming? If they need help with the appearance, then that's what appearance recovery is. If they need help with pain or nausea and that's symptom relief. Otherwise, a lot of them are coming for mind-body treatments, which help with stress relief and relaxation. So we might have somebody who has petechiae, which is a type of rash where the blood, it looks like little blood splatters or little hematomas in the skin. And so to cover that, we might have to do remedial camouflage. You might have somebody that has a rash from the targeted therapy drugs, which can be a red inflamed rash with pustules. Provided the person is not immune suppressed, you can do extractions. You may need to converse with the oncology team to see whether you can do the extractions. But somebody may stop taking their medications if that rash is really debilitating. So we need to be using product that can help to reduce any inflammation in the skin and to also help prevent any kind of infection if we're going to do this. So there's a lot that we can do with skincare. And you will find oftentimes healthcare professionals will support healthcare professionals. So an oncologist might recommend that the actual patient go to a dermatologist versus coming to us. So we need to up our ante. We need to show that we're our professional. We need to know we're not taking over the dermatologist job, but we can also help the cancer survivor. And you need to promote yourself to your clients, friends and families, and anybody that you could have as a potential client. You need to promote that you also have a very, very strong role in their recovery. Hair removal and growth, this needs to be something that is taken more seriously about healthcare as well. When I say hair removal, sometimes people develop hair as a result of their medications, and so the hair needs to be removed, and can it be removed safely? Other times people have hair loss from chemotherapy mostly, and some areas of radiation, and so we need to help people with hair growth, whether it's using products to stimulate the hair growth, whether we're, for example, on lashes. I spoke about this, I think, on Monday. How can we help with people that have lost their lashes and give the appearance that they have lashes? So there are hair removal and hair growth modalities that we can work with. And brow and lash reconstruction is really, really important to a person's psyche. You know, the brows create this beautiful frame for the face, and when somebody doesn't have lashes, a person almost has the appearance of a ghost of themselves, and they're not comfortable with that. So when we recommend that estheticians do remedial camouflage or corrective makeup as part of our training, we are not teaching you to do wedding makeup or beautiful makeup for photography or nightclubs and stuff like that. We are seriously helping people with physical issues on their skin resulting from either the treatment or from the cancer itself. You know, sometimes people have terrible scars and they need the scars to be covered. Other times there's a hyper or a hypopigmentation resulting from surgery, chemo, or radiation. Sometimes there's rashes that need to be covered. So there's a lot that we can do to help people when they're going through cancer treatment. So the more that we can promote this, the more that healthcare professionals will look at us. The other thing, we need to also be a voice and a voice together with insurance companies, because a lot of those other modalities I've just spoken about, insurance will cover a lot of them, but these here on this slide, they're not being covered. And the more the insurance companies can hear from us, the more they're going to listen to us and cancer survivors. Now, unfortunately, with the coronavirus issue that's going on, cancer survivors are possibly, and I've heard that a few of them going through treatment right now, are not getting as much attention because everything is placed on the coronavirus. So, you know what? It's going to be an interesting shift to see how things work their way through to when everybody is not in lockdown anymore. What's really important for your salon spa menu is to make sure that you include caregivers. And does your menu even mention caregivers? Because let me tell you, from a psychological and physical aspect, caregivers sometimes do not have, well, I'd say very often they don't have the coping skills to cope with being a full-time caregiver, because they could have been in you know, business, they could have had their own company, they could be employed by somebody else, and so they're completely focused on whatever their career is, and now all of a sudden they've got to become a full-time caregiver. And a lot of the times there's not actual good training out there for caregivers to do what they have to do, and they have to learn on the job. So a lot of them struggle with coping skills and their emotions and also their confidence. And I have found that sometimes caregivers can also isolate themselves as well, because they get into a routine that is wake up, go and take care of the cancer survivor, and then finish off their day. And everything has all been around the cancer survivor and not themselves. So I'm giving you an example of a spa menu that one of my graduates created, and I helped her with it based on what she is trained in and what she wanted to do, because she was trained in all these various modalities. The first thing is she offers a complimentary consultation. And anytime you're working with a cancer survivor, you need to do a good intake form, and it needs to have their medical history, the medications, the side effects, everything that you can think of, because that's really important for you when you have to modify the treatment. So she has one facial listed here, and that's the key, is keep it simple. Even if you do offer 20 different facials, you only put one on here, because right now, if somebody's going through active treatment, you're going to soothe, hydrate, and protect the skin. If they're in recovery, they'll be focusing on rebuilding and restoring the skin. And once you get the skin to its optimum, then start focusing on, you know, the pigmentation issues and all the other things. So start it and keep it simple. Per facial, $65 for 50-minute treatment. It might need to be shortened. That just depends on the client and how the client's skin reacts. She offers a hand, foot, and scalp therapy. Same thing, 50 minutes, but they're different parts of the body, so the person might be able to tolerate, you know what, 10, 15, 20 minutes in different areas of the body. If you're going to work with somebody's scalp, please make sure you have their permission to do so, because not everybody is comfortable with you touching their scalp. The body wrap that she offers is $65 for 50 minutes, and this is well worth it. She takes a very mild exfoliation, which is like a jojoba bead cleanser, body cleanser, and she just gently exfoliates the body, removes all the exfoliant, and then she hydrates the skin. And the purpose behind the body wrap is to hydrate, then gently wrap them, even if you're wrapping them with an occlusive barrier, to keep, as the body warms up, it'll just keep it there within the occlusive barrier and stay on the skin. And whilst this is happening, the client is getting a scalp massage. Then she's got a makeup application and an eyebrow and eyelash enhancement, and this comes as a lesson that teaches the survivor how to apply makeup in a natural way so that they look healthy, and how to cover, imperfections like redness, scars, uneven skin tone, etc. And also, if they don't have brows and lashes, or they have sparse brows and lashes, how to build onto what they have currently to enhance their features for them. She also does a wig fitting consultation. She has wigs that are in her business, so she will do a comp fitting if somebody purchases a wig. But wigs today, everybody can buy them online, and so maybe tie in with a wig company if they will allow you to do it. Have a few wigs, on site with different styles and lengths and whatever. And if somebody orders it online, then she gets a commission or something. Same thing with the prosthetic or the breast forms, because it's a lot of stock. I mean, you'll be surprised how many different sizes, shapes, colors of breasts there are out there. And to try and match something for every color, shape, and size, it's a huge amount of stock that one would have to purchase. So if there's a company that can help you with just the basic few items, or if there's a way to do it virtually and then the person buys it from the company and has a drop ship to them, then you still get the benefit out of that. And so here is the Caregiver's treat she has. It's $65 for 50 minutes, and it's actually a signature facial. Personally, I would prefer to do a reflexology session, perhaps a mini facial, scalp massage, or something that the caregiver really wants. Now, some caregivers might prefer, a manicure and a pedicure, whatever. Maybe the option is up to the value of, or give them a few options. I can do just what I mentioned there now, or I could do a manicure and pedicure, or I could do reflexology and a pedicure. So whatever fits into the 2 hours, and that is approximately the same price for each. So maybe give 3 different options for the caregiver. When we talk about equipment in the salon and the spa, and we're talking about electrotherapies like LED, laser, radio frequency, microcurrent, all these pieces of equipment that we spend a lot of money on, and all of a sudden we're saying, you know what, keep it really simple and don't use these machines or equipment on people that are going through active treatment. And whilst there are absolutely no clinical studies to show and support them being used on cancer survivors, we're just saying treat each person as an individual case, because it might be a case-by-case situation that you can do this. There are some oncologists that are quite comfortable with microcurrent for somebody who's in recovery. And so microcurrent can be done according to some oncologists, whereas other oncologists will say absolutely no way. So there's got to be a bit of give and take between the healthcare professional and us with regards to the client. Sometimes clients are not interested in what the oncology professional or the healthcare professional and us say. They actually want the treatment. So you need to do due diligence with this. You do a really good intake form, have the client sign off on these different things, and you know what, make the modifications that you have to make. At the end of the day, you really want to make sure that it's safe for everybody. So the common thread that you keep hearing me about is appearance recovery. And I'm mentioning this because a lot of people that get diagnosed with cancer will experience anxiety and depression. They also start to develop body image issues if their appearance has been affected. And so this affects their self-esteem. A lot of these survivors have to learn to cope with these changes and accept them because they have to deal with them every day. Now, some people will see cancer as a life-changing experience and they'll say, you know what, I've survived this, I'm strong, that's fine. But there's a majority of people have to learn to cope with these changes and they struggle with them. So their self-esteem is low and we can help them. I do want to just point out this picture that I have here is actually somebody undergoing chemotherapy. And this was taken in Brazil when I went down there to do some training. She had a pink t-shirt on. I was demonstrating airbrush makeup because, to be honest, I love the airbrush machine. I love that it is so quick and easy, that I don't have to dab brushes and sponges onto a person's skin. So I'm trying to avoid everything that could be contaminated with bacteria and viruses and stuff. So 6 to 8 drops of the airbrush makeup covered her face. I did the blusher and I actually did her brows using a stencil with the airbrush machine. And it took me no more than 10 minutes because I was busy talking to, you know, all the people that were learning about the airbrushing. But if I was just doing it quickly, this should take you no longer than 5 minutes, 3 to 5 minutes to put on somebody. I think the brows would take a little bit longer because you have to really position them, you know, to kind of match each other. What we also did there was talk about different ways to wrap scarves on people's heads. I happen to have this particular scarf with me, which matched her shirt. She loved it. She was absolutely delighted with her appearance after that. So that's the difference you can make to somebody, and it's so simple and not expensive. And reasons to help: when somebody has issues with their body image, their self-esteem is low, they want to isolate themselves. They don't want to be seen. They don't want to meet new people. They don't want to be touched and get affection from anybody. So sometimes somebody might have had a breast removed. They don't want to hug. When it comes to their partners or even us as a salon or spa professional, they don't want to undress or let us see their scars or imperfections, even if it's discoloration on the skin. As cancer survivor might end up gaining a lot of weight if they're on corticosteroids. On the other hand, if they have cachexia, or they just start to lose weight because of the disease, because they're just not feeling well, because they have constant nausea, diarrhea, they're just not eating, so they start to lose weight and they really start to form that skeletal look as well, and they're embarrassed about it. There are people that just are so ashamed of the fact that they have cancer as well, and they just can't accept themselves for who they are. So again, we're embracing people and we're trying to encompass their emotional, physical, you know, every aspect of their psyche to make sure that they feel better. Each of our webinars, we talk about a particular modality. Here I'm going to talk about sugaring because people still want to have hair removed, and I'll compare it to waxing. So sugaring typically uses no heat, whereas waxing uses heat and can cause redness to the skin as a result of the heat. Sugaring typically doesn't tear at the skin, and yet waxing can tear at the skin. Again, technique is important. So both modalities, the person doing the treatment has got to have a really good technique to make it safe and not painful. Sugaring typically should pull hair only, whereas waxing can pull the skin and the hair. So what one has to be really careful about is when we're applying wax or sugaring to the skin, a person with a low platelet count can bruise and bleed very easily. We know that removing hair can cause pain to hair follicles and cause inflammation. Can we make this as pain-free as possible and also help reduce any kind of inflammation? We also know that if we tear the skin or we burn the skin, there's a risk for infection, and if we cause any redness and inflammation to an area with lymphedema, then the person will have an exacerbated case of lymphedema, or it could trigger lymphedema. So be very aware of that. I did, I believe, a half-hour webinar with Love to Sugar, the Sugar Tribe. If you want to watch it, go onto their website and have a look at that. And it's very specific to sugaring with a lot of the different side effects that you need to pay attention to. Two people I want to mention before we finish up today is Renee Surbon, a fellow colleague here in Canada. She has created this skincare group on Facebook, and it's called the Strategy Shift Group. And this is about the coronavirus and how it's affecting our business right now. But how can we strategize now for when we start to actually get back into our work world? So if you have the opportunity, go onto her Facebook group, ask to be accepted, because she will have professionals all giving their input that can help when we get back to work. Tazim Jamal, she is a spa coach, and she is doing a webinar tomorrow called Navigating from Chaos to Calm. Also, again, focusing on the chaos surrounding the coronavirus and a lot of our businesses being shut down, and how to get things for all of us to calm down and to move forward. And her webinar tomorrow is listed on her Facebook group, and it's at 11 o'clock Pacific Standard Time. Okay, we've come to the end of our webinar here for the day. This is going to be uploaded to our YouTube account in about an hour. I want to thank you for joining us. I hope that this was informative for you. If you have any specific questions, email us on info@oti-oncologytraining.com, and have a wonderful evening.